Hello, beautiful people. This is Steffi B, and I'm here to study with you guys and get ready for those comps in nursing school. I'm sure you're stressed. If you're struggling, if you're not struggling, I heard the best way to study is by going over questions and saying things out loud, talking things through. So that's why I'm here. I'm here to study with you guys and say things out loud, and my dog is knocking things over. So today we're going to focus on fluid and electrolytes if my camera's not going to fall over. So I'm going to go ahead, I'm going to read the question, going to read the answers. If you need more time, just hit the pause button and we'll go over the correct answer and the other answers. Listen guys, I'm human. I might not pronounce everything perfectly, so don't judge too hard. All right. First question. The nurse is caring for a client with heart failure. On assessment, the nurse notes that the client is dyspneic and crackles are audible on auscultation. What additional manifestations would the nurse expect to note in this client if excess fluid volume is present? 1, weight loss and dry skin. 2, flat neck and hand veins and decreased urinary output. 3, an increase in blood pressure and increased respirations. Or 4, weakness and decreased central venous pressure. I'll give you guys a minute. If you need more time, just hit the pause button. So the answer here is number 3, an increase in blood pressure and increased respirations. Why? All right, so we need to answer the question. What is the question asking us? The question's asking, what manifestations will we see in a patient who has excess fluid volume? If we look at the options, 3 of them are describing fluid deficiency, right? And only 1 is describing fluid volume overload, right? So if somebody has a lot of fluid, they would be gaining weight, right? So they would not have weight loss or dry skin, right? If you check for skin tenting, it would be less than 3, showing hydration, right? So if they're dehydrated, it would be over 3. They would not have flat neck and hand veins, right? So their jugular vein would be distending, right? Their hand vein would be distended. It would be bounding, right? Their body has so much fluid. And decreased urinary output, yeah, their body's holding on to all that sodium and fluid, right? So for this kind of answer, both parts have to be right for the whole answer to be right? Because their kidneys are not filtering all that sodium and fluid out of their body, or pushing out that fluid, right? We're retaining all that fluid in our body. So it's causing edema, it's causing weight gain, right? So it's causing our veins to be distended and bounding. All right, let's move on. Weakness and decreased central venous pressure. So no, it would be an increase in central venous pressure, right? So usually, normally the pressure is between 2 and 7. And increase would be above 7, right? And that is the pressure of the superior vena cava, right? So the only one that's fluid overload, yeah, their blood pressure would be high, right? Because their body has a lot of fluid. And their respirations, their body is working hard with all this fluid, so their heart is working, right? So their lungs are working, right? And they would have crackles in their lungs, right? They would have bounding pulses, right? And their hematocrit, would it be high or low for somebody that has fluid overload? It would be low, right? If they're dehydrated, it would be high. Number 2, the nurse is preparing to care for a client with potassium deficit. The nurse reviews the client's record and determines that the client is at risk for developing the potassium deficit because of which situation? 1, sustained tissue damage. 2, requires nasogastric suction. 3, has a history of Addison's disease. Or 4, uric acid level of 9.4. I'll give you a minute to answer. So the answer here is number 2, right? Requires nasogastric suction. Why? Let's look at the question and look at what it's asking. It's asking, which situation would we see potassium deficit? So we know there's 3 answers where it would show a situation where potassium would increase and 1 would decrease. 1, sustained tissue damage. So if a patient has damaged tissue or burns or cell lysis, they would have an increase in potassium. A history of Addison's disease for number 3. If we know Addison's disease, we know that they have hyperkalemia, So hyponatremia, high potassium, low sodium. Number 4, uric acid level of 9.4. That's elevated, right? So usually it's up to 7 for female, 8 for male. So we know it's elevated. So somebody who has a high uric acid level, they would have high potassium, right? Because we know with potassium, that means you're more acidic, right? So that's hyperkalemia. So if we look at number 2, requires nasogastric suction, if they have an NG tube in and they're putting the suction on, it is removing potassium, right? So they're going to be deficit. So that's the answer, number 2. Number 3, the nurse is monitoring a child with burns during treatment for burn shock. Which assessment provides the most accurate guide to determine the adequacy of fluid resuscitation? 1, skin turgor. 2, level of edema at burn site. 3, adequacy of capillary filling. 4, amount of fluid tolerated in 24 hours. The answer here is number 3, adequacy of capillary filling. Why? Let's look at the question. The question is asking, what is the most accurate guide to determine the adequacy of fluid resuscitation, right? Let's look at the options. Number 1, skin turgor. If we're checking their skin turgor, right, and we're looking for tension, if it's less than 3, more than 3, if they're hydrated, if they're dehydrated, is it gonna tell us the adequacy of fluid in their body by looking at the skin elasticity? No, it won't. The level of edema. Number 2, the level of edema at the burn site. If we're looking at the burn site and we see pitting edema 3+, 4+, will that tell us? No, it'll give us information, right? Number 4, amount of fluid tolerated in 24 hours. So if we look at the amount of fluid and their intake, no, right? Their urinary output volume would give us more information, right? But the answer here is number 3, right? We want to check their capillary fillings, right? We want to make sure they have adequate blood flow through their body, right? If their heart's pumping blood, right, and it's going to our extremities, right, upper and lower, we're going to check their capillary refills and we're going to check to see if it's under 3 or over 3, right? That's what we want to look for. All right, number 4, a child is hospitalized because of persistent vomiting. The nurse should monitor the child closely for which problem? 1, diarrhea. 2, metabolic acidosis. 3, metabolic alkalosis. Or 4, hyperactive bowel sounds. I'll give you guys a minute. Answer here is number 3, metabolic alkalosis. Why? Let's look at the question. What is the question asking us? The question is asking us, what do we monitor in a patient that has persistent vomiting? What do we look for, right? So we know, or we should know, that vomiting is very acidic, right? So if we're vomiting, right, that acid out, right, and they're losing that acid, then they would have more base, right? Their pH would be higher, right? So the answer would be metabolic alkalosis, right? So for example, if this patient has diarrhea and they're pooping, and they're losing that bicarbonate, what should they monitor? Metabolic acidosis, right? Because their pH would be lower. Question number 5. The nurse is completing an assessment on a client who is being admitted for a diagnostic workup for primary hyperparathyroidism. Which client complaint would be a characteristic of this disorder? Select all that apply. 1, polyuria. 2, headache. 3, bone pain. 4, nervousness. Or 5, weight gain. I'll give you guys a minute. The answer here is 1, polyuria, and 3, bone pain. Why? Let's go back to the question. The question is asking which client complaint would be a characteristic of hyperparathyroidism. What do we know about hyperparathyroidism? We know that their calcium will be elevated, right? So number 1, Polyuria. Their body will be trying to pee out all that calcium, right? And number 3, bone pain. Where are they getting that calcium from? Their bones, right? So if they're pulling that calcium from their bones, they're gonna have some bone pain, right? And then they might have some weight loss, right? Because if they're peeing out all that calcium, they're losing fluid, right? So they might lose some weight, right? They're not gonna gain weight if they're losing fluid. Number 6, a client with pulmonary edema has been receiving diuretic therapy. The client has a prescription for additional furosemide in the amount of 40 milligrams intravenous push. Knowing that the client will also be started on digoxin, which lab result should the nurse review as the priority? 1, sodium level, 2, digoxin level, 3, creatine level, or 4, potassium level? What do you guys think? Give you guys a minute. The answer here is number 4, potassium level. Why? Let's go back to the question. What is the question asking us? The question is asking us, what lab result do we need to check right now before they get digoxin? This patient comes in, they have pulmonary edema, they're on furosemide. What do we check, right? We need to know this. You want to check their potassium level, right? You want to make sure it's between 3.5 and 5. If they have hypokalemia, under 3.5, they're at higher risk for digoxin toxicity, dysrhythmias, right? Of course you want to check their other labs. Of course you want to check their creatine level and see how their kidney function is. But the most important lab that you want to check is potassium. All right, pop quiz. What medication is it that a patient's prescribed where you want to check sodium, where that's the top priority lab that's most important? What do you guys think? Lithium, right? So if a patient is prescribed lithium, you want to go to their lab and you want to check their sodium level, right? And also too, you want to teach them to maintain a consistent sodium diet, right? So if their sodium intake decreases, it can cause their lithium level to increase. And we want to make sure they have a therapeutic range between 0.6 to 1.2, right? So if they have a low sodium intake and their lithium level starts to increase, they can go into toxicity, lithium toxicity, right? So we want to educate our patients and let them know that if they experience nausea, vomiting, vision changes, tremors, any of these symptoms, to go to the ER. All right. Number 7. The nurse is assessing a client with a suspected diagnosis of hypocalcemia. Which clinical manifestation would the nurse expect to note in the client? 1, twitching, 2, hypoactive bowel sounds, 3, negative Truas sign, or 4, hypoactive deep tendon reflexes. The answer here is number 1, twitching. Why? Let's go back to the question. The question is asking, what would we see in a patient that has hypocalcemia? Hypo is low, calcemia is calcium. If they have low calcium under 9, what would we see? The range is usually 9 to 10.5. We would see twitching, right? Everything would be hyperactive. And a good way to remember this is, let's just say you're walking into a club, right? And you have potassium and you have sodium and they're DJing, right? They're in the club and they're throwing some beats down, they're DJing that music. And in the front you have magnesium and you have calcium. They're bodyguards in the front. They're in the front, and let's say you don't have a lot of bodyguards that night, right? And they're not a lot, so not a lot of magnesium, not a lot of calcium, so it's low. A lot of people are gonna go into that club, right? So the club, it's gonna be going, right? It's gonna be hyperactive. There's gonna be more people, more commotion, right? So think of hyperactivity, right? So think of twitching, right? Hyperactive bowel sounds. Your GI system will be going, right? Hyperactive deep tendon reflexes. Your tendon reflexes will be going. Positive Truot sign. Your Truot sign will be going. That's when you put a blood pressure cuff on your arm, right? And you'll see twitching. T, Truos, T for twitching. That's a good way to remember it. Positive Chavoke sign. If you go like this, you'll see twitching. Hypocalcemia. That's a good way to remember it, guys. Let's turn it around. Let's say that you're in the front of the club and you have too many bodyguards. So you have a lot of magnesium and a lot of calcium in the front, right? They're not letting a lot of people into the club. So the club is going to be a lot calmer, right? There's not much commotion going on in the club, not a lot of activity. So you would see hypoactive bowel sounds. So things are slower. Your GI system is slower, right? Negative Truot sign, right? If you put the blood pressure cuff on, you wouldn't see any twitching. Hypoactive deep tendon reflexes. Your tendon reflexes would be slower. All right. Question number 8. The nurse assessing a client hospitalized with a diagnosis of hypoparathyroidism notes positive Truot and Chavoke sign. The nurse determines that these findings most indicate which electrolyte imbalance. 1, hypokalemia. 2, hypocalcemia. 3, hypernatremia. Or 4, hypermagnesia. The answer here is number 2, hypocalcemia. Why? Let's go back to the question. What is the question asking us? It's asking us if we have a positive Truot sign and a positive Chavoke sign, what electrolyte imbalance would we have? Remember, T for Truot, T for twitching, right? Chavoke sign, C for Chavoke sign, C for calcium. And if you go like this, that's Chavoke sign. And Chavoke sign is when you have a blood pressure cuff on your hand, and you'll see T for twitching. So here the answer is 2, hypocalcemia. Remember, you're walking into a club, you have calcium and magnesium in the front, they're bouncers or they're bodyguards, right? If you have very few of them, right, hypocalcemia, then you're gonna have a lot of people going into that club, so it's gonna be hyperactive, right? There's gonna be a lot going on. So you'll see like twitching, right? Think of overstimulated, like tetany. So that's one way to think about it. So if a patient has hypocalcemia, one way to treat them is by giving them calcium gluconate. Number 9. The client recovering from an acute kidney injury demonstrates an understanding of the therapeutic dietary regimen when indicating a need to limit which dietary factor? 1, fats. 2, vitamins. 3, potassium. Or 4, carbs. Here the answer is number 3, potassium. Why? Let's go back to the question. What is the question asking us? It's asking us if a patient comes in and they have acute kidney injury, what dietary factor do we limit? We have to think of the role of the kidneys. What do the kidneys do? The kidneys play a big role with potassium. They balance potassium in our body and they also excrete it from our body. So if we have a patient that has kidney injury and they're not able to excrete potassium, they are going to be at a higher risk for building up potassium in our body and be hyperkalemic. And they can be at a higher risk for getting life-threatening dysrhythmias, and we do not want that. So we want to make sure that if we have a patient that comes in, they have acute kidney injury, we give them teaching on a low potassium diet. A low potassium diet is a diet that has green beans, raspberries, pineapples, grapes, lettuce, right? If a patient has low potassium and they're hypokalemic, usually their magnesium level is also low, so you want to check their lab for magnesium as well. Number 10. Last one. The nurse is caring for a child diagnosed with a GI disorder. The nurse notes that the laboratory results indicate a potassium level of 3.2. Based on the lab finding, which clinical manifestation would the nurse primarily expect to note in the child? 1, nausea, 2, muscle weakness, 3, increased bowel sounds, or 4, elevated blood pressure. I'll give you guys a minute. And the answer here is number 2, muscle weakness. Why? Let's go back to the question. What is the question asking us? It's asking us if we have a potassium level of 3.2, what would we expect? What is a normal potassium level? It's 3.5 to 5. So we know a patient that comes in and has a potassium level of 3.2, they would be hypokalemic. Think of that analogy I told you. You're walking into a club, right? And you have potassium and sodium as the DJs. And you have magnesium and calcium at the door. They're bouncers that night, right? So you have potassium, they're the DJ. And let's say that you don't have a lot of potassium DJs that night. The music will be delayed, it won't be right, everything will just feel down. So think of everything just not going right. Everything is just off. You're feeling it's just down. So they may or may not have nausea. Number 2, muscle weakness. Yeah, their muscles will feel weak. They won't feel right. So just think of down, like weak. They will have decreased bowel sounds. They will have decreased blood pressure. So if you have a patient that's hypokalemic, you want to teach them how to increase their potassium and what foods they should eat. All right, guys, we're all done. We did 10 questions on fluid and electrolytes. I hope this helped. Guys, good luck on your comps. If you like this video, hit a like, leave a comment. I just want to know if I should do more videos. I might still do more videos, do more practice questions, talk things through. And again, practice questions make a big difference. I did pretty well on my first comp, and I have my second comp coming up too. So you will see a lot more videos coming up. All right, guys. Bye, beautiful people. See you soon.